Okay, so this is case study 1, an overview of how to complete your case study. I want you to read this very, very carefully, and you can see I've highlighted in bold some particular words. All right, so have a good read. Once you've read it, the questions I need you to ask, to write, to type out, and you can use this format as long as you put the headings in, and you have to follow the headings. I want you to be able to comprehend a paragraph about Janet and what's happened in her incident. So I need to change that, in her incident. State some facts of the incident in your own words. Do not make anything up. Now, in this paragraph, can you describe to me some of the concepts of her wellness? Meaning, what are the positives and negatives? So she's had to come into hospital, but think about how she used to be, and she's in hospital for a short period of time. But what's the positives of her being in hospital with her family and herself? And what are the negatives of her being in hospital between her and her family? Just so you know how you're getting into their world. So just a small paragraph on that. Now, I want you to describe in a few sentences, maybe like about 3 or 4 lines, lower torso. What does that mean to you? Okay, you know what lower means, and you know where the torso is. Put an image in and just describe where it is. Hematoma, probably a little bit more of a description. What does hematoma mean to you? What body system is it affected, and how is it developed, and how you get it, and what is happening once you've had a hematoma? Sciatica, how does it occur? What are the common causes, maybe? And how not so much how do you get it, it's where it is, where it's happening, and what is it doing to the body. Fractures, what does fracture mean? Okay, and what types of fractures possibly? Okay, so probably about half a page on that. Now, Janet had a hip replacement a while ago. I just want you to do a little bit of research about what does a hip replacement involve. Now you know about the skeletal system. It's part of a long bone. It's pretty intense. It's in one of the most easy movable joints, a ball and socket joint. So if you could just find out what happens in this operation, that they have to cut through certain muscles and they have to re-stitch up, and what care you're going to give as a health carer in that first week of cares. Same with spinal fusion. Remember, it's on the lower part of the back, so it's in a lumbar. What is the spinal fusion? Okay, how many vertebrae can actually happen in a spinal fusion? And what care is given as a carer? Cool, just a small paragraph on that. Now, this is where you get most of your points, and you have to follow these headings. If you do not follow these headings, you'll be marked down because I'll be looking for the answers. You do not put in treatments, okay? It's out of your scope of practice unless they are holistic. So, eczema. What system is eczema affecting? So it's to do with your integumentary system, isn't it? So what I want you to do, this is the biggest part, describe how the body system is affected and how it should work. So how the skin, the epidermis, should work, okay, with all the layers and the basal layer and keratinization and desquamation, and how it should work when it's working perfectly. And then when someone develops eczema, what is actually happening to that body system? Okay, here we go. Describes what's happening to the body system affected when they have that disease or disorder. So these are really two big gutsful paragraphs. I want you to find as many signs and symptoms, look and feel of this condition that you would see and the person would feel. And be clear what you see and what the person feels. Then the last one is describe the normal and abnormal observation ranges related to the disorder and how your monitor change. So with eczema, you're going to be observing the patchiness, the redness, is it aggressive? Has the topical cream that person's been using making it better? Is the areas becoming spreading, going wider, or are they reducing? So how are you going to monitor that change? This is where you've got to actually do quite a bit of research. We don't talk massively about this in class, but enough for you to know where to find the information. Keeping your scope of practice. If there is such thing as injections or steroids or severe medication, you make sure you state that they're from the GP or the RN, okay? And your job is there just to monitor. So you're going to do that for eczema, then exactly the same for skin ulcer. Now remember, describe how the body system affected should work in homeostasis. Skin ulcer, eczema is all part of the integumentary system. So you can actually just do exactly the same for that part. But of course, it's different when what's happening to the body when the system's affected. This is about the blood flow not getting to the epidermis, isn't it? Signs and symptoms are very different and they're in stages. Observation ranges related to this are very different to eczema. All right, so then you go into osteoporosis, rheumatoid arthritis, muscular atrophy. So osteoporosis and rheumatoid arthritis and muscular atrophy are from the skeletal system. Sorry, they're not. Muscular atrophy isn't. That's quite different there. So you just talk about the makeup of the skeletal system, the types of bones, and what the functions are. And then when it's to do with osteoporosis, I want you to mention the osteoclasts and osteoblasts and the imbalance there. Rheumatoid arthritis is to do with infection, or not so much infection, is to do with the autoimmune system within the synovial fluid causing the deformities. And muscular atrophy when the muscle is shrinking. Now, I hope this gives you a tipping off the iceberg, and each one of these will be about a page long. Okay, always refer back to this because this is what I'm looking for. Okay, this is where you're going to get your top marks. All right. And good luck, and make sure this is an example of someone when they did chronic renal failure. This is a really in-depth example, really in-depth. So I don't expect it to be this long at all whatsoever, but it's fantastic reading, that's all. Please give me an email if you're stuck, honestly, on the Facebook website, email, and then I'll be happy to help. Thank you.